Thank you very much. Now I request the Chief Economic Advisor for the presentation, please.
Esteemed dignitaries on the dais, including all my senior colleagues from the Economic Division. Let me first start by thanking the Honorable Prime Minister, the Honorable Finance Minister, the Honorable Minister of State for Finance, Secretary Economic Affairs, and the entire team of secretaries in the Ministry of Finance. And last but certainly not the least, my really capable and dedicated team here that has worked through a very, very difficult year amidst people falling sick, family members falling sick, and in the last few days have literally burnt the midnight oil. How much ever I thank them is not enough. I would also want to thank PIB and the Director General, Sri Dhatwalia ji, for arranging this presentation, and wish everyone in the country good health and prosperity in the new year. This year's economic survey is dedicated to all the COVID warriors who have really helped in upholding India. If you see the cover of the economic survey, we have the COVID warriors joining hands to uphold India. Doctors, nurses, scientists who have helped in developing the vaccine in record time, sanitation workers, one and all, who have come together in this time of adversity to really uphold India. The cover also captures the V-shaped recovery that has happened in the economy. In fact, mirrors the V-shaped performance that the Indian cricket team delivered in Australia as well. After being shot out for 36 within an hour, they went on to win the series. So the resilience of the Indian economy is actually mirroring the resilience of the Indian cricket team as well. This year's survey is therefore dedicated to all the COVID warriors. It's about saving lives and livelihoods, about the V-shaped economic recovery, and the fact that in this year of adversity, when a once-in-a-century pandemic has hit us, India has really outweighed on the opportunities that this pandemic provides compared to the risks. That is also being shown in the cover. Keeping up with the times, and as they say, necessity is the mother of invention, this year's economic survey is being delivered in an e-book format, and the economic survey app has been launched, which I will just show now. To understand India's policy response and the situation that India faced in March, let's imagine traveling in a Mumbai local. Typically, about 500 people travel in a Mumbai local train in one coach. Now, if suppose the trains had been running during the COVID times, this is just a thought experiment, just one person being infected in the coach could have infected 500 other people in the space of just 1 hour. In contrast, if these 500 people were working from home, as they indeed are, to infect those 500 people, it would take many days. 1 hour versus many days, 500 people that would infect actually would go and infect many more. This example displays the impact of network effects in the spread of a pandemic, the fact that the size of the population matters, the population density matters, and that is essentially the situation that India faced. And the first chapter in the economic survey in volume 1 is about India's policy response, saving lives and livelihoods amidst a once-in-a-century crisis. India's response was guided by research in epidemiology and economics. Nobel Prize-winning research by Lars Hansen and Tom Sargent, which I had the privilege of learning from both of them. Their research advocates that when faced with enormous uncertainty, policies must aim to minimize large losses. Now, faced with a pandemic, that large loss was loss of human lives. As it is said in the Mahabharata, Apadi pranaraksha hi dharmasya pratham ankuraha. Saving a life that is in jeopardy is the origin of dharma. And that is the principle that guided India's policy response. India recognized that GDP growth will come back, and it certainly has, but human lives will not. India's policy response also derived from the extensive research on epidemiology, especially that looked at the Spanish flu epidemic of 1918 to come up with its policy response. One of the key things that was pointed out was the need for the pandemic curve to be flattened, because that gives time for the health and the testing infrastructure to be ramped up. In particular, one of the key learnings from this research was that the pandemic spreads faster in higher and denser populations, and that the intensity of the lockdown matters most at the beginning of the pandemic. A 1 unit increase in the population density has far greater impact on the spread of the pandemic at the onset of that pandemic compared to later. And this is one of the key reasons, one of the key points of research that guided India's policy response. Therefore, the early intense lockdown, India recognized, not only saves more human lives, but also enables a quicker, better economic recovery. The survey team has done a lot of work to show what could have been versus what actually happened. What could have been depends on, as I said, population density. It depends on the number of elderly people we have in the population. Even though India is a young population, just in absolute numbers, the number of elderly people we have is very large, and in fact larger than most countries. It depends on the number of tests that are conducted. It depends on the entire demography as well. And so, the survey team has analyzed what could have been versus what was, and that is being displayed in this particular chart, where the expected cases versus the actual cases is displayed, similarly for deaths as well. Green corresponds to actually the actual cases being lower than the expected cases, while red is the opposite. And both on cases and on deaths, India has done really well. India avoided about 37 lakh cases, according to the survey's estimation, and about 1 lakh deaths through the strategy that it adopted. The same analysis has also been done across states in India. And here as well, the expected cases and expected deaths has been taken into account. While looking at deaths, the health infrastructure also has been taken into account to estimate what could have been. One of the key things that stands out here in terms of under and over performance across states, Maharashtra is the underperformer, both in cases and in deaths. In cases, Uttar Pradesh, Gujarat, and Bihar are the overperformers, while on deaths, Kerala, Telangana, and Andhra Pradesh are the overperformers. Now, importantly, what we do is to go and relate this to the stringency of the lockdown that was imposed. We do this not only across all countries, but also across states in India. When we analyze across countries, we find that the intensity of the initial lockdown correlates strongly with the difference in the estimated versus the actual cases across countries. But when we do that across states as well, we see the same pattern where the stringency of the lockdown across states correlates with the cases and the deaths. And for this, the survey team actually has done outstanding amount of work, the team here, in developing an index, stringency lockdown index, for the Indian states. This can be used for future research as well, because this mirrors the Oxford University's index that has been developed across countries. Using this index, that basically we show here that the performance in terms of cases and deaths correlates very strongly with the stringency of the lockdown. Now, we certainly recognize that correlation does not translate into causality. And that's why the state-level analysis that we are doing is very important. Before I come to that, let me also talk about the economic performance. So if we relate the stringency of the lockdown to the contemporaneous effect, in other words, if the lockdown was more stringent in a particular month, what was the impact on the economic indicators in that month? And what was the impact of the stringency of the lockdown in that month on future economic indicators 3 months later? And what you see is on the left, you see actually a negative correlation, which is the decline contemporaneously. And on the right, you see the positive lagged effect, which is the V-shaped relationship, which is the V-shaped recovery that we witnessed in the economy. Now, as I was referring to earlier, correlation does not necessarily mean causality, and that is why the state-level analysis is extremely important. To show the causal impact, we need to show that other factors are not accounting for this correlation, whether it's at the country level or at the state level. Now, one of the key worries actually from a cross-country analysis is that it could be Indians have higher immunity than others, and therefore India actually ended up having much less cases and much less deaths. It could possibly be that the BCG vaccine, that all of us have, provides immunity against the pandemic, and which maybe other countries have not had. It's possible that the environment that we live in here, that is what reduces deaths intrinsically, or it could be that anything else but the intensity of the lockdown that India did actually accounts for this correlation. The strong correlation of cases and deaths that I showed across states is important in this. I also showed the V-shaped recovery. Why? Because anything that is peculiar to India, whether it's BCG vaccine, higher immunity, the environment that we live in, is common across all states in India. Take a Maharashtra, take a Gujarat, take Karnataka. These are all common across all states in India. So the correlation that we've shown cannot come from anything that is specific or peculiar to India. And that is why the state-level analysis controls for several of these other factors that may account for India's performance, and therefore actually leads the survey to infer that the lockdown had a causal impact on saving lives and on the economic recovery. In this context, it is also important to keep in mind the intrinsic effect of the pandemic itself. Even without the intense lockdown, for their own safety, individuals would not have gone out anyway. And most of us are still observing many of those precautions. Contact-based service sectors would be severely impacted. Many of us, for instance, before the pandemic, would have gone for a massage, which maybe we have not done that because it's a contact-based service. So many of us have taken these precautions intrinsically. Also, the precautionary motive to save, which is something that macroeconomics highlights, that whenever uncertainty is high in the economy, all households and individuals tend to save more, thinking that maybe we will need that saving for a rainy day. Therefore, the precautionary motive to save goes up, during times of uncertainty, and that certainly reduces discretionary spending, because households may think that if we were going to buy a car, or let's say we're going to buy a house, say, let's wait out this period, maybe 6-7 months, see how the uncertainty pans out, and then we can do whatever discretionary buying. So intrinsically, again, the pandemic would have impacted discretionary spending. Further, the risk aversion and the uncertainty of demand would have also affected corporate investment, because similarly, corporates would also want to wait out and see how the pandemic spreads, how the economy performs, before they actually go and make irreversible investment. So even without the lockdown, these effects would have manifested, as they have indeed in other countries which did not have as intense a lockdown early on as we had. So even without this lockdown, the pandemic would have created significant economic impact. What the lockdown did, though, was to coordinate this response across the entire country, brought awareness of the dangers of this pandemic, and that coordination is something that macroeconomics emphasizes enormously on. On the economic side, India realized that this pandemic has both demand side and supply side impact. The demand side impact, though, is very nuanced. And India's policy response took into account that nuanced effect of the pandemic on demand. On the left side, you see this chart which shows the Pradhan Mantri Jan Dhan Yojana balances, how they increased during the period of the lockdown. You see that the average balance increased by about 400 rupees during the months of the lockdown. Now remember, there are 40 crore accounts, PMJDY accounts, and these are accounts at the bottom of the pyramid. Typically, economists think about the marginal propensity to consume is very high for these households. This is basically jargon to say that if the household at the bottom of the pyramid gets 1 rupee, they're likely to spend 97-98 paise. So they do not typically save as much. But even in this demographic, during the lockdown, the savings went up on average by about 500 rupees, which is illustrative of the precautionary motive to save, and thereby the impact that it would have had on the discretionary spending. And that is also being seen in the deposits that have increased, the savings that have come into the banks. So realizing that at the onset of the pandemic, when the uncertainty is very high, also the lockdown actually imposed economic restrictions, India approached this in a calibrated manner. In the first part, when the uncertainty was very high, India's policies focused purely on ensuring necessities. 80 crore people were given free food, possibly the largest free food program across the world. Emergency credit measures were given, liquidity measures were announced, and forbearance was also announced. These were all necessities from an economic point of view. And they were optimal at that time, given the uncertainty and the resultant precautionary motives to save, as well as the economic restrictions that I talked about. What India recognized very well is that pushing down on the accelerator of a car while the brakes are already clamped only wastes fuel. Only when the clamp on the brake is removed, at that time pressing on the accelerator actually speeds the car forward. And that is something that India recognized very well. Therefore, as part of its calibrated response, in the unlock phase, India has actually gone ahead and announced demand-side measures to enable discretionary consumption to come in. The Atmanirbhar Bharat 2 and 3 measures have focused on capital expenditures. A wage subsidy program was announced as part of Atmanirbhar Bharat 3, and the focus on the national infrastructure pipeline has been enhanced. So all these will go towards increasing discretionary spending in the economy. So India's demand-side response was again unique and in a more calibrated manner. On the supply side as well, and India recognized that the pandemic will have supply-side impact too, because of possible disruptions in labor markets and the financial distress that firms could have to face, which could lead to impact on the productive capacity of the economy. And therefore, a slew of structural reforms were announced to enhance supply in the medium to long run, to avoid loss of productive capacity. These reforms primarily focus on strengthening the potential of the primary and secondary sectors, and they are intended to create jobs and thereby enable aggregate demand in the economy. And as part of these, the survey details this, describes this in detail, streamlining of labor laws, the broad-based reforms in agriculture, MSMEs, the BPO in the service sector, power, mineral sector, space, defense, all these were part of the reforms that were announced as part of the Atmanirbhar Bharat mission. And importantly, the strategic PSU's policy. It's a very important statement of intent. If you recall, in the last year's economic survey, the impact, the wealth creation that comes from privatization was talked about. The strategic PSU policy has actually implemented that by giving the commanding heights of the economy to the private sector. This is given the history of India in its first industrial policy, having given those commanding heights of the economy to the public sector. So this is a very important statement of intent. So to summarize, the policy response that India came up with was a mature, far-sighted one. India focused on saving lives and livelihoods, took short-term pain for long-term gain, recognized that while GDP growth will recover, and it has, lost human lives cannot be brought back. This was the humane principle that guided India's policy response. India was the only country to announce a slew of structural reforms. India's demand-side measures were also different from the other countries, were more calibrated, recognizing the simple idea that pushing the accelerator, works only when the brakes are removed. The V-shaped economic recovery, without a second wave, makes India, therefore, a sui generis case in mature policy making. The mega vaccination drive that is now on should enable this recovery, especially in the services sector. In a time like this, fiscal policy becomes very important. The second chapter, therefore, focuses on fiscal policy. The title is, Does Growth Lead to Debt Sustainability? Yes, but not vice versa. Let me start with a simple example to illustrate the main idea. Suppose you borrow and invest rupees 100, and you borrow it you have to pay an interest cost of, let's say, 8%. And let's suppose that the investment gives you 12%. The return that it yields is 12%. So you can borrow that in year 1, rupees 100. In year 2, 108, which includes 100 rupees principal and 8 rupees interest, you can repay. The return is 112, so you can pocket 4 rupees and keep it with you. But because you have actually generated more, you can do this again. You can borrow another 100 rupees and keep doing this as long as the interest rate that you have to pay is less than the growth rate that you actually can generate or the return that you can generate. And this is captured very well by the American Economic Association's presidential address that was given by the then President Olivier Blanchard in 2019, where he says that if the interest rate paid by the government is less than the growth rate, then the intertemporal budget constraint facing the government no longer binds. The intertemporal budget constraint is just basically some difficult words for what I've illustrated using this simple example, that you can keep doing this over and over again, and as long as the interest rate that is paid is less than the growth rate, This debate has happened in the advanced economies because of the significant decline in their interest rates. But the same idea also applies to India because of the high potential growth rate that we have and the fact that the growth rate is higher than the interest rate. And this idea is captured by what is called the debt equation for debt dynamics. Without getting into the math, let me just give you the basic idea that if the interest rate is greater than the growth rate, then you do not get debt sustainability because debt as a proportion of GDP will increase because you don't get enough to be able to repay the interest cost. But if the interest rate is less than the growth rate, then debt as a percentage of GDP certainly declines. And that is the key idea that is being captured here. The evidence is supportive as well. If you look at the left panel here, what is being shown is the interest rate growth rate differential at time t on the x-axis, and the change in the government debt in the y-axis. And you see that as the differential in absolute magnitude is higher, the change in the government's debt is also higher. And this is in fact coming from greater movement in the growth rate, because the difference between the interest rate and the growth rate can come both due to changes in the interest rate as well as due to the growth rate. What the chart on the right shows, that when you look at the variation in interest rate and growth rate over time, it is the change in the growth rate that is changing the interest rate growth rate differential, and thereby impacting the debt to GDP ratio. And that is a key point, therefore, that it is growth that actually leads to debt sustainability, not necessarily vice versa. And this is important given the countercyclical fiscal policy that is important, has to be followed in times like these. The chart that you see on top is showing the public sector and the private sector balances. That is just sort of economic jargon for how well the private sector is doing and how much the public sector is supporting it. Countercyclical fiscal policy, essentially, the idea is as follows, that economies have peaks and troughs. When the economy is doing well, the private sector is doing well, government can step back at that time. But when the economy is not doing well, the private sector itself is not doing well, that's when the government needs to move in to actually support the economy. That is the idea of countercyclical fiscal policy. If you look at the United States and United Kingdom, two advanced economies, where this correlation between the public sector and private sector balances is very, very negative, minus 0.9. And this is over a very large period, starting from 1987 on up till 2019, the correlation is minus 0.9. In other words, when the private sector is doing well, the government steps back. When the private sector is doing badly, the government steps in. That's what leads to the negative correlation. But when you see in India, same period, the correlation is about minus 0.3, very low. And that's the basic idea that actually is being advocated in this chapter, that countercyclical fiscal policy must become an important point of emphasis when we think about especially times like these. This chapter also goes and examines debt sustainability in various scenarios, especially some of the worst case scenarios. There's a lot more details in the chapter. I'm just going to show you one snapshot here. This particular chart here shows the growth rate that can potentially be obtained from FY23 onwards, different scenarios, and how the debt to GDP will change based on those scenarios. I want you to focus on the worst case scenario here, which corresponds to nominal growth rate of 9%. Assuming an inflation of 5%, mid of the 4 to 6% band, this translates into a real growth rate of 3.8%. So what this slide shows, and this analysis shows, is that even if India were to have real growth of 3.8% in each year from FY23 to FY29, the debts will still come down. And it will basically come down because the nominal rate of interest would actually be higher than, nominal rate of growth would be higher than the nominal rate of interest. There are also lessons from something that India has already done in the past. We've been there, done it. When the Asian financial crisis happened, growth had come down from, over the entire 98 to 2003 period, the growth was only 5.3%. And debt to GDP had in fact increased at that time, had reached then historical levels of 83%. But the government went and did expansionary fiscal policy, focused on infrastructure spending, which basically did increase government expenditure, and general government debt actually went up. But as a result of that, as a result of the fiscal and the infrastructure push, the average growth from 2004 to 2009 was 8%. And that growth is what then brought debt back from 83% to 70%. So we've been there, done it, and we basically need to just replicate and learn from that experience. So that's the essence of this chapter. The policy recommendations that emerge from this are that fiscal multipliers, which is basically economist jargon for saying if 1 rupee is invested by the government in the economy, by the fisc, what is the return that is generated for the economy? Fiscal multipliers are typically much higher during slowdowns in the economy or during downturns when compared to peaks in the economy. And therefore, this is a very important aspect to take into account. Fiscal policy must support growth, therefore, till the pre-COVID growth path is achieved again. Public investment spending, is self-financing in the medium term precisely because it enables growth, crowds in private investment, and that in this context, India's fiscal rules, which certainly, which may not be enabling a countercyclical fiscal policy, must need a rethink. The third chapter looks at the India's sovereign credit rating. If you look at the fifth largest economy in the world, and ask the question, what is the rating of the fifth largest economy over the last 2 decades? If you start from 1994 here, and this chart shows that, so the fifth largest economy, remember, has changed. So that, if you think about it, that baton has changed hands. Italy was the fifth largest economy at some point in time. UK was, China became the fifth largest economy, and now India is the fifth largest economy. So the question that is being asked here is, when a particular country was the fifth largest economy, what was the credit rating of that country at that time? So asking the question, over the history of sovereign credit ratings, what has been the rating of the fifth largest economy? Now this is important because the GDP actually is the amount of activity that happens in the economy, and therefore the size of the GDP essentially captures the country's ability to repay debt as well, and that is why this question is important to ask. And when you ask this question, 2 key points emerge here. Firstly, that typically the fifth largest economy has been rated AAA. You see that actually, those flat lines at the top. The only 2 exceptions to this, and that is the second point that is coming from this chart, are China and India. When China became the fifth largest economy in 2005, it was rated A-, while India now is the fifth largest economy and is rated BBB+. So in other words, this historical anomaly essentially is focusing on emerging giants versus those that are established giants. The emerging giants actually are not necessarily getting the rating that their fundamentals possibly demand. And that is the subsequent analysis that is done in the chapter. So I'm going to just give you a sampling of that. On this particular chart, we show the credit rating, sovereign credit rating, as a function of the growth of the country, economic growth. You see a positive relationship. In other words, higher growth leads to higher rating, which is expected. But what I want you to take away here is India actually lying below the line, significantly below this line of fit. And this is being done by looking at peer economies, in other words, countries that are within the same credit rating range, so that we do an apples-to-apples comparison. But India clearly lies below this line, and this is not just now, this has been the case over the last 2 decades. So whether it's 2000, 2005, 2010, 2015, or 2020, India lies secularly below the line. And this is then examined across a variety of indicators that are supposed to impact credit ratings: inflation, general government debt as a percentage of GDP, cyclically adjusted primary balance as a percentage of GDP, current account balance as a percentage of GDP, the political stability, rule of law, control of corruption, investor protection, ease of doing business, short-term external debt, reserve adequacy ratio, and the sovereign default history. Across all these indicators, India comes out as an outlier in a similar manner, which is what leads the survey to ask the question, does India's sovereign credit rating reflect its fundamentals? And using this analysis, the survey answers no. Now, another aspect actually is really important when we talk about sovereign ratings or ratings in general. Rating is nothing but a mapping of the probability of default. In other words, if you are called a AAA, it corresponds to a certain probability of default. If you are called B, there's a certain probability of default. That is all a rating is. Now, when you unpack that, the probability of default is affected by the willingness to repay, as well as the ability to repay. The willingness to repay for India is gold standard because India has never ever defaulted on its debt obligations. You know, all of us remember even in 1991 when India faced a balance of payments crisis, we shipped gold to the Bank of England to honor our obligations. That is reflecting India's willingness to repay. The ability to repay is also very, very high. So firstly, if you look at just the sovereign's foreign exchange obligations, and that is what the rating agencies look at, and you exclude the bilateral and the multilateral debt that the credit rating agencies do not consider, that part is very, very minimal. So if you look at India's structure of debt, the part that is in foreign exchange, excluding these, is very, very minimal. So sovereigns' foreign exchange obligations are almost non-existent, really minimal. But because India does not have full capital account convertibility, we also need to take into account the private sector debt. Now, when the private sector has to repay its foreign exchange obligation, it has to approach the Reserve Bank, pay rupees, get the equivalent foreign currency, and use that equivalent foreign currency to go and repay their creditor. Therefore, the foreign exchange reserves matter, in looking at this. Now, if you look at short-term debt of the private sector, in other words, what is due in just 1 year, India's reserves are adequate to even withstand a 0.1% probability event, which is 1 in 1,000 times. And when you look at India's total external debt, not just the short term, you look at the entire debt, short term plus long term, public sector plus the private sector, which is the total obligation of the entire economy in foreign exchange terms, that amount is less than the reserves. In other words, our reserves are more than adequate to take care of all our obligations in foreign exchange. Therefore, India effectively resembles a negative debt company whose ability to repay, by definition, is 100%. So on both the willingness to pay and the ability to repay, India should have the highest rating. And this is consistent with a large literature that highlights these kind of aspects in sovereign credit ratings. There's a large literature in finance and financial economics that actually talks about this, that I've had the privilege of reading. Now, therefore, it's not surprising that the markets do not react very strongly to credit rating changes. If you look at across the equity markets, foreign exchange markets, or the fixed income markets, the impact is actually very, very low. And given the analysis that we've actually shown you, that is not surprising. So the important policy implications that come from this is that India's sovereign credit ratings do not reflect its fundamentals. Therefore, the ratings methodology, and this is not just true with India, I showed China as well when it became the 5th largest economy, the ratings methodology needs correction as they affect the foreign portfolio inflows in a mechanical manner, because many investment vehicles just do a mechanical rule where if the rating is above investment grade or in investment grade versus if it is not, they have mechanical rules and which affect the foreign portfolio inflows. So the rating methodology does have an impact on this, and the issue of procyclicality in credit ratings, which needs to be addressed, and this has been debated in the G20 as well. An important issue in the current context, especially given the COVID pandemic, is of inequality. Let me start to anchor the idea by giving you a simple example. All of us, when we were young, we remember the show Malgudi Days. Many of you today also might have watched it when it was replayed on Doordarshan. Remember Swami from Malgudi Days? Swami is very good at mathematics. Swami gets 100 out of 100 in his mathematics exam. His friend Shankar gets only 60 out of 100. His headmaster takes 20 marks away from Swami, gives it to Shankar, and tells Swami that I do not like this difference in outcomes. I wanted both of you to have 80 marks, and therefore I did this. Swami comes back crying to his mother, and tells his mother that, Amma, I am not going to study for maths anymore, because anyway I'm going to lose 20 marks. That's going to be taken away from me and given to Shankar. Why should I study? Shankar goes very happily to his mother and tells her that, Amma, I got 80 marks. I don't need to study anymore because anyway the principal is going to give me 20 marks more. Now, do you think that this equality that was achieved was desirable? Swami also then puts an argument to his mother saying, why does not the principal give more teaching to Shankar? You give him more, allocate more teacher time so that Shankar can become really good at mathematics and he can himself get 80 out of 100, in his examination. I can keep my 100 marks, which I've worked really hard for. Wouldn't both of us be better if, I keep my 100 that I've gotten from my hard work and he gets 80 from his hard work as well? That we are actually, total marks is 180 versus 160. This idea that when you grow the pie, 160 versus 180, in the earlier example, when 20 marks were being redistributed, the pie is remaining the same. But in the second case, when you have 180 marks, the Shankar's marks are also higher without reducing Swami's marks. And that's the idea that actually is being captured, given the level of development that India is in, and the debate on inequality that is happening in advanced economies. This is a pertinent question that we need to ask, because finally macroeconomic policy and economics itself always faces trade-offs. And therefore clarity of objectives is very important for policy making. So the question that is asked here is, inequality and growth, is there conflict or convergence in the Indian context? So if you look at the advanced economies, and the survey does, this chapter in the survey does a lot of correlation with all kinds of socioeconomic indicators. I'm going to show you a couple, refer you to take a look at the chapter for the others. So if you'll focus on the top panel here, which is being shown in red, the red dots, that is for the advanced economies. On the x-axis, inequality is plotted. So when you go to the right, inequality is higher. And on the y-axis, what is being plotted is socio-economic outcomes. In the right panel, it is basically national income per capita. So for the advanced economies, what you notice is that an increase in inequality reduces health outcomes, while an increase in the national income per capita improves health and social problems. So they actually have this conflict between the income per capita, which is delivered by growth, and inequality. When we do the same analysis in India, by looking at inequality across the Indian states for which the data is available, we find that there is no conflict. If anything, there is convergence. Both inequality and income per capita, which, as I said, reflects the impact of growth, have similar impact on socioeconomic indicators. Now, this is what I've shown for health. You see the same thing for education as well. Down, up for the advanced economies, same up for basically for the Indian states. And this is shown across a bunch of other indicators like life expectancy, infant mortality, birth and death rates, fertility rates, crime, drug usage, mental health, etc. That this convergence in India is something that is being seen across these indicators. And survey basically poses the question that this is something that reflects possibly the stage of development. Given our stage of development, our potential growth rates are very high. At the same time, our ability to increase the pie and thereby uplift a lot of the people out of poverty, that potential is also very high. In contrast, in advanced economies, both those are possibly low, and that may be accounting for the conflict that you see in the advanced economies vis-a-vis what we see for India. So what this chapter therefore recommends is that India must continue to focus on growth so that it expands the pie, and by expanding the pie, thereby redistributive policies are enabled to lift people out of poverty. And this is important because when we go and look at the impact of growth versus inequality on poverty reduction, about 85% of the reduction in poverty comes from growth. Only 50%, 15%, and it's not a very strong relationship either, comes from inequality. And this is true whether we use the headcount ratio of poverty or the multidimensional poverty indices as well. So the message that comes out, therefore, is that unlike advanced economies and the commentary that is being often focused on in the advanced economies especially, there is no conflict between growth and inflation. In fact, there is convergence. Given India's stage of development, India should therefore continue its focus on economic growth to lift the poor out of poverty by expanding the overall pie. Because redistribution is only feasible in a developing economy if the size of the economic pie grows. And that relates back to the example I gave about Swami versus his friend Shankar. Let me give you one more example to illustrate the ideas that are covered in Chapter 5 and Chapter 9. I'm sure everyone here has watched the movie Three Idiots. If there isn't one who hasn't watched it, may raise his hand or her hand. I'm going to focus on this particular scene in Three Idiots when Farhan and Rancho go to have dinner at Raju's place. When they're having dinner, Raju's mother talks about how a large part of her salary goes into the medical expenses of Raju's father. And then she laments that because so much of the salary goes into health expenditure, there isn't enough money left for household spending, let alone being able to prepare for Raju's sister's wedding. Now, this particular scene, albeit displayed in a darkly humorous manner, is actually representative of the situation that often many families in India may find themselves because of high out-of-pocket expenses on health. And that's what these two chapters get into, especially given the COVID pandemic, which has really ensured that healthcare takes center stage finally. These examinations are quite pertinent. So this chart shows what I just talked about. So in this chart, the domestic general government health expenditure as a percentage of overall overall general government expenditure is shown. Remember, health is a state subject, and therefore it is important to focus on the general government expenditure. And in India, in fact, a large bulk of the spending on health is done by states. So if you take the general health expenditure as a percentage of the general government expenditure itself, as you increase that, clearly the out-of-pocket payments actually as a proportion of the overall health expenditure comes down. But what is really important here is the non-linearity in this effect. That at small levels of public spending on healthcare, when you increase it even by a little bit, the impact on the out-of-pocket expenses is very large. And that is what is being shown in this chart here. If India were to move from what it currently is to 2.5% of the general government expenditure, then the decline in the out-of-pocket expenditures for households that are similar to Raju's family will be very large. It will come down from about 60% to about 30%, so more than half, and that will make a big difference to these families. Incidentally, this chart also shows where other countries are. Take a look at Thailand, for instance. Thailand is closer to 3%, and Vietnam, China are other countries which actually are being marked out here. So this captures the idea that if we increase the public spending to about 2.5%, then the impact on out-of-pocket expenditures of typical families like the one I referred to, Raju's family, would be very, very large. The other important aspect that has been, that is very important, but critical to take into account in the context of healthcare is the problem of asymmetric information. And this has been highlighted by Nobel Prize winner Kenneth Arrow more than half a century back. In fact, now 57 years. So where he wrote this article about asymmetric information in healthcare. And that's why if you think about it, all of us care about the reputation of the doctor or the hospital we go to because of the endemic information asymmetry problems that we face in healthcare markets. And so the basic argument that Kenneth Arrow and others since have made is that laissez-faire in healthcare may not be the optimal way of organizing healthcare because of these asymmetric information problems that lead to market failures. And when there are market failures, free markets do not necessarily deliver the best outcome. And this chart shows some of that. This and the next part, what I'm going to show, gives you evidence in the Indian context. So this is data that we are showing for the amount of spending on the same ailment. So whether it's cardiac, procedure, cancer, or if it's an injury, and these are all inpatient, procedures. What it shows here is the difference between the amount that you have to spend if you go to a public hospital or government hospital versus if you have to go to a private hospital. Remember, it is being within the same procedure. So, for instance, what stands out is that if it is a cardiac procedure, the typical patient ends up spending about 7 times as much, when he goes to a private hospital as it would be if it were in a government hospital. This is about 3.7 times for cancers, about 5.2 times for respiratory illnesses, about 6.2 times for gastroenteritic illnesses, injuries about 6 times. Across the board, across each one of these illnesses, the spending is much higher in the context of, when it's private healthcare versus public. Now, the one question that will definitely arise from this is that it could be very well true that the quality of care that is provided in the private hospitals is significantly better than that in the public hospitals. So which is the natural question to ask, and we ask that question in this chapter and go and look at the data. We go and look at the data on the readmission rates. Research in healthcare looks at readmission rates, the same patient coming back and admitted again as a proxy for the quality of treatment that that patient got. It's a well-recognized proxy in the healthcare research arena. When you look at the data from PMJAY on the difference in quality using this proxy, what stands out is that public sector patients get readmitted to the same hospital 64% of the time, while this same number is 70% for private hospitals. So from this, we can make the inference that it certainly may not be true that the quality of care that is being provided in the private hospitals is significantly better than that in the public sector hospitals. Now, one has to take into account, I'm not saying from this that public sector hospitals are necessarily providing better care. The reason I don't say that is even within the readmission cases, it could be that we choose for the more difficult cases, private hospitals are chosen. That possibility exists, and therefore one can't infer from here that the quality of care is definitely better. But it does not seem to be the case that the quality of care in the private hospitals is significantly better than the public hospitals. That this evidence does not show. Now, when you put that together with what I showed you in terms of the prices, then you see the problem of asymmetric information that Kenneth Arrow talked about. And therefore, healthcare design, the system design in healthcare becomes really critical, given that about 65 to 67% of care is provided by private sector hospitals in India. Another important point in this context, given the COVID pandemic that we have gone through, is the need to incorporate flexibility. What we have to be careful is to ensure that we do not get affected by saliency bias. Behavioral economics talks about this facet called saliency bias, which is you overweight the most recent piece of evidence. The reason the survey talks about this is that it's possible that we may end up doing too much, responding to take care of pandemics, which are basically communicable diseases, and not care as much about the non-communicable disease burden that India faces. So India has to be careful to ensure that healthcare policy is not affected by this saliency bias, but it must still incorporate agility and flexibility into its healthcare infrastructure, because the pandemic that comes next time possibly may be different from what we have right now, and therefore this flexibility becomes really important. And as I just showed, given the market failure due to asymmetric information, better regulation of the healthcare sector is critical to ensure that the benefits of healthcare reach the common people. And in this context, the Pradhan Mantri Jan Arogya Yojana has played an important role. Even though it's only a few years, we basically go and for the first time bring data from Ayushman Bharat. and look at what has been the impact of that. Before I show you the actual analysis across states, I'm going to show you what is the kind of procedures that people are using as part of the PMJAY. So general treatment is what accounts for most, and in fact, a large part of the use of PMJAY is for treatments that are between the 10 to 15,000 rupees range. So that's typical care that not very, very serious. The serious ones, which is your cardiothoracic, vascular surgery, etc., are far lower. The density of that is much lower, as you can see from the distribution that is being shown in the top chart. In the bottom chart, what has been shown is how during the COVID times, it seems like PMJAY has played a role in enabling people to get treatments, important treatments, but high-frequency ones like dialysis. So you see the plot here of general medicine, which is the top one, and you also see the pre-authorizations for dialysis. What stands out is that there is no impact of COVID on the dialysis pre-authorizations, but there is a significant, a sharp and a V-shaped kind of effect on general medicine. In other words, general medicine did get impacted by COVID and the lockdown, but crucial, life-saving procedures like dialysis were not impacted through PMJAY as using dialysis as an example. We then go and look at states that have adopted PMJAY versus states that have not adopted to try and show the impact of PMJAY. We do this in two ways. I'm just going to show you one part here, which is we first take all the states in India, club them into those states that have implemented PMJAY and those that have not implemented. First, look at the baseline, and then compare after. So here it is important. We use the NFHS data, which provides a very nice before-after, because the NFHS 2015-16 is before PMJAY, which got implemented in 2018, while the NFHS 2019-20 is after the implementation of PMJAY. So we get a good before-after. We can compare the baseline as well and see the impact on health outcomes. But before that, what we do is to look at the impact on actual insurance, health insurance in the population. And what we find is that when you look at the 2015-16 data, compare that to 2019-20, the insurance coverage has increased by about 54% in the states that adopted PMJAY, but it has declined by 10% in states that did not adopt. Now, when we go and examine the same thing in the context of several health-related measures like infant and child mortality rates, maternal and child health, treatment of childhood diseases, we find significant impacts, and those are all there in the chapter 9 of the economic survey. For paucity of time, I'm not going to go into it. There are also some spillover benefits that are coming on things like child vaccinations, awareness of HIV, AIDS among adults, etc. These are certainly not direct impacts of PMJAY, but spillovers that seem to be coming as well using the NFHS data. Now, the survey recognizes that comparing all states that implemented PMJAY versus those that did not may not be a very, very sharp comparison. And that is why the survey does another piece of analysis by focusing on contiguous states. So we take West Bengal, which did not implement PMJAY, and compare that to 3 adjoining states, Bihar, Odisha, and Sikkim, which are all in the northeast, in that, and therefore very similar. And then we also find that the baseline characteristics using NFHS 4 is similar for almost identical on many dimensions between these West Bengal and the 3 neighboring states. And we show then that the results that we obtain across all states, the same kind of results we get even in the much more careful, more apples-to-apples comparison as well. And this is what econometricians call a difference in difference. The before app did not implement PMJAY, which gives you a better approximation of the causal effect because many confounding factors are taken into account. And the survey therefore infers that these inferences, these results that we get using all states are also being seen using a more careful comparison among just the contiguous states. The survey in the last few years has been focusing on various aspects of the regulation and the process. In earlier years, the judicial reforms have been covered. Ease of doing business was covered last year. This year, the survey looks at some process reforms that are important to have in the, to enable the economy to grow further. Let me give you a simple example here again. Many of you would have watched this show, Office, where this person, Musaddi Lal, is shown to actually go running from pillar to post, having to look to get some simple things like getting a license or having his car changed from, let's say, Delhi to Mumbai, or, and that captures the idea of the number of procedures that often a common person has to go through in just doing some simple common tasks like getting a license or maybe getting a car, the registration changed from one state to another. So that's the idea that this chapter is capturing. And this is based on very, very important work that's been awarded the Nobel Prize recently in 2018. The work on incomplete contracts was awarded the Nobel Prize. Oliver Hart and Oliver Williamson and Bengt Holmstrom got the Nobel Prize for their work on incomplete contracts. This work actually recognizes something that we all see in the real world, that contracts in the real world cannot take into account all the different contingencies. You cannot really anticipate all the different things that can happen in future and code it into a contract. That's the basic idea, of the incomplete contracting literature. A branch of this literature also talks about how, when contracts are incomplete, you also get incomplete regulations. When you acknowledge the incomplete contracts, the incompleteness of contracts, you also have to then acknowledge the incompleteness of regulation. One of the key things that the survey shows is that if you take a company that does not have any dispute or litigation, all the paperwork is complete, and this company has to be closed in India, it takes about 1,600 days. In fact, to be precise, 1570 days to close such a company. Remember, this is a company that does not have any litigation, no dispute, all the paperwork, everything is complete here. The same number for OECD economies is about 600 days. For Singapore, it's 120 days. Another important statistic, just to complement what was shown in the last year's survey, looking at the number of permissions that is required in Delhi, for instance, for getting, for having a restaurant. So similarly here, the survey is showing that the number of procedures that is required to close a company that is all clean is far too cumbersome. This is also reflected in the amount of discretion that results because of excessive regulation. The basic idea is as follows. If there are several pieces of regulation that somebody who has to supervise has to take into account, that person may not have the bandwidth to go through all those pieces of regulation, may just focus on a few. Suppose there are 100 ticks that have to be done, the person may choose to focus on 15 or 20, and then you get very, very opaque discretion. The set of 15 or 20 that one supervisor focuses on may be very different from what another focuses on. And that is the idea that when you have excessive regulation, that leads to opaque supervision and exercise of discretion. The evidence for that is being shown in these two charts here. What is being plotted on the x-axis is the number of de jure days that it takes to get a permit, a construction permit. De jure days, in other words, what is stated as procedure, the number of, you have to get this clearance, you have to get that clearance. You put all that together and you come up with a de jure, in other words, the letter of the law, the number of days it takes to actually get a construction permit. That is being plotted on the x-axis. On the y-axis, what is being shown is the actual number of days that it takes. Remember, on the x-axis, what is on the letter, and on the y-axis is what is the actual number of days. To just solidify ideas, suppose in a particular state, let's say, it takes 100 days to get all the permissions. Some people may be able to get that permission, that construction permit, in 50 days, while other people may be able to actually get it only maybe in 200 days. So this difference between 200 days versus 50 days, when on the letter it is 100, captures the amount of discretion that is being exercised. Because the person who is giving this permission is exercising discretion in giving it in 50 days, for one, and making it hard by, taking it 200 days. So this range captures that discretion. And what this chart shows is that as the number of procedures increase, which is reflected in the number of, de jure days it takes, the discretion increases significantly as well. In other words, when you have excessive regulation, that leads to excessive supervision as well, not the other idea where that, simple rules lead to actually too much discretion. It is counterintuitive, but it's a very, very important point. And this is seen not just in the case of construction permit, but also in getting an operating license. And this captures the important idea why regulations have to be simple so that discretion can be exercised and supervision can be done in a transparent manner. And that's the idea, that those are the policy recommendations that come from this chapter, that simple regulations combined with a transparent decision-making process, improved transparency in supervision, stronger systems of ex-ante accountability, such as through bank boards in the context of banks, and in general boards across various agencies, and importantly, very robust ex-post resolution mechanisms. During COVID, as I actually had mentioned when I spoke about the policy response, countries across the world have given regulatory forbearance. To understand its effect, let's take a simple example. Think about the last time you fell sick, you went to a doctor, and the doctor gave you medicine. The doctor gives you some emergency medicine and tells you to eat that medicine for 3 days. But you are scared about getting that disease back. Having taken the medicine for 3 days, you're still scared you may get that disease back. So instead of taking it for 3 days, you eat that medicine for 3 months. Now think about the impact that it creates on your health, on your body. That emergency medicine was, of course, very, very important. It was inevitable. It was required. You needed to take it for 3 days. Not taking that medicine, emergency medicine, would have harmed your health. But taking it for 30 days or 3 months also harms your health. Instead of actually protecting the health, that really makes it, worse. And that's the basic idea, that regulatory forbearance is emergency medicine, not a staple diet. This is seen in the context of the 2008 global financial crisis. Much like now, after the global financial crisis, because the economy was impacted, firms were impacted, forbearance was provided. The forbearance, though, much like emergency medicine that became staple diet, was continued for 7 years. This chart here shows how, whether you looked at GDP growth, exports, the index of industrial production, or credit growth, each one of those, the chart is marked there. In 2011, about 2 years after the forbearance was given, things had improved very well. The 3-day medicine that the doctor prescribed had already had its effect. The body had actually gotten better. But for fear of actually possibly continuing, maybe getting that disease, that forbearance was continued for 7 years. And last year's economic survey, volume 2, the first chapter, talked about how the banking sector problems actually were responsible for the growth slowdown. This particular analysis here is very important, given the fact that forbearance has again been provided to ensure that we actually, we do not repeat some of those issues and ensure that the banking sector emerges much more healthier this time around. So the chapter does extensive analysis. This is an area that I've actually done a lot of research on. Based on that, looks at and talks about regulatory forbearance as emergency medicine, not staple diet. What effectively happened was that banks, because of the forbearance regime, could pretend that their non-performing assets were performing by calling them restructured assets. Because the provisioning requirements were lower, so banks continued to window dress their balance sheets, which led to several unintended effects, leading to unhealthy firms lending to unhealthy firms, evergreening, and low provisioning. Now, during COVID, regulatory forbearance has been provided, and that is a good thing. It should be done like the 3-day medicine, but the important policy lesson here is to avoid a recurrence of the issues that manifested following the global financial crisis. Another important aspect here is that the AQR that was done could not bring out all the hidden bad assets that led to underestimation of capital requirements. The design was such that it did not mandate capital raising by banks, which led to undercapitalization, increasing sharply in the banks, and that led to a second round of lending distortions that first happened initially when the forbearance was provided, thereby exacerbating an already grave situation. So it's important, therefore, here to learn these lessons and ensure that they are not repeated so that the banking sector emerges healthy in the current round of forbearance. Chapter 8 of the survey looks at innovation. India, for the first time, got into the top 50 countries in terms, in the Global Innovation Index. And therefore, the survey actually thought it fit to examine India's innovation performance, see areas where India has done very well, and areas where India needs to improve in order to aspire to become among the global innovation leaders, really gather momentum from this entry in the top 50 innovative countries to go further. So when you look at the innovation rank, for its level of development, whether you take all the countries or you take the top 10 economies, India is doing well. India is a positive outlier, much higher positive outlier when you look at the entire sample of countries. Outlier still when you look at the top 10 economies, but India's aspiration must be to actually become as innovative as the top 10 economies. And here, India must certainly aspire to increase its gross expenditure on R&D from about 1.5 to 3%, of GDP, which is the average for top 10 economies. And in this, the key insight that the survey provides is that the private sector participation in gross, general expenditure in R&D becomes really critical, because business sector in India contributes 37% to gross expenditure on R&D. In the top 10 economies, this percentage is 68%. So the business sector, therefore, contributes far less in terms of the gross expenditure on R&D compared to the proportion in the top 10 economies. In contrast, the government contributes about 56%, which is 3 times the average for advanced economies. That proportion is 22% for the advanced economies. So the government is contributing a lot. It's for the private sector now to actually really ramp up its expenditure on R&D and to grow this expenditure from the current levels to the levels that will be closer to the advanced economies. And the private sector really needs to step up in this. And by the way, the survey also points out that this particular situation is not because the tax incentives in India are actually less liberal. If anything, they are actually more liberal. But this is an aspect that the private sector needs to focus on. Focus on innovation just to be competitive, because that is what is really critical in the new economy. The last chapter of the economic survey focuses on the bare necessities. Popular media and movies have actually focused a lot on this. There is this movie called Roti Kapda Makan. Many of at least those of us from my generation might remember, which focuses on these bare necessities. What the survey does, therefore, is to go and create an index of the bare necessities that a typical household gets across India. By using the NSSO surveys, looks at how these have improved across states, how have they improved across different income quantiles, and how have they changed across states. So if you look at the at the situation in 2012 versus 2018, this is the India map here. The colors actually denote the extent of access to the bare necessities. Green means that the access is very high. Red, in contrast, means that the access is low, and yellow means that the access is is medium. So this is constructed using about 26 variables across water, sanitation, housing, micro environment, and other basic facilities. 26 indicators have been taken to analyze, to come up with this bare necessities index. What you see is that across the country, across all states, there has been improvement at the all India level in the access to bare necessities. States like Punjab, Gujarat, etc. do fare really well in access to bare necessities. Some of the eastern states actually need to ramp up on this. If you look at in terms of rural India, which was in 2012 was almost all red, now appears to actually lot more yellow. So there's been a significant improvement. There are still parts that actually have red, which need to work on. And if you look at the urban India, which was primarily yellow in 2012, now at least half of urban India seems to have become green. So there's been an improvement here as well. So across all India, rural and urban, when you look at the access to bare necessities in 2018 versus 2012, there has been secular improvement in the access to bare necessities. But what is most important is when we look at the inequity in the access to bare necessities. And this is important because, while rich people have access to private sector solutions, if you don't get good water, you possibly can get a filter. You can buy a filter. If you don't have, if you're bitten by mosquitoes, you can actually get all kinds of facilities. But poor often don't have access to such private sector solutions. And therefore, the inequity in access to bare necessities is also a very important thing that the development must focus on. After all, if you remember Gandhiji's talisman, think about the Daridra Narayan and think if your policy is indeed helping that Daridra Narayan. Keep the face of that Daridra Narayan and see if the policy has impacted him. So what this chart shows is that the poorest, the access to bare necessities for the poorest has increased significantly. Q1 is the poorest quintile, while Q5 is the richest quintile. And this is, the blue is for 2012. The green is for 2018. So you see that both at the all India level, rural and urban, the improvement in access has been much more for the poorest people in the country, while rich have also, access also has increased, but not as much. And thereby the inequity in this has reduced significantly. So to summarize, India is witnessing a V-shaped economic recovery. This is a testimony to the resilience and the intrinsic strength of the Indian economy. When history will record India's policy response amidst a once-in-a-century pandemic, history will come to the conclusion that the policy making was mature. The ability to take bold decisions, to continually calibrate responses, the willingness to take short-term pain for long-term gain, which is what displays maturity in policy response. These together signify the policy maturity and the alacrity with which the government responded to the once-in-a-century pandemic that all of us are witnessing. Given the large vaccination drive and the swift rollout of the same, we present this survey with optimism on both the health and the economic fronts. At the same time, humbly requesting each one of you to continue observing the caution that all of you have observed so far in admirable manner till you get vaccinated. Thank you very much.
Thank you very much. I think it's a very detailed one. Thank you very much. Friends, now we can take some questions.
Extensive presentation by CEA on the economic survey, and Ajay, a broader overview. He touched upon the swift rollout of vaccine and how the economy during the pandemic time, the policy making had reached that sort of maturity to see to it that the damage is minimized, economically speaking?
ये बहुत इंपॉर्टेंट दस्तावेज था जो अभी आर्थिक सर्वेक्षण के जरिए देश के सामने रखा गया। आपने देखा कि जो कोरोना पैंडेमिक के दौरान हमने देखा कि जो सुधार के कदम लिए गए, जो अर्थव्यवस्था को एक तरह से मजबूती देने के लिए या फिर उनको रिकवरी करने के लिए जो कदम लिए गए, वो ज़मीन पर कितना जल्दी असर दिखाते हैं, वो एक असेसमेंट दिखाई देता है। बहुत स्पष्ट तौर पर जो आर्थिक सर्वेक्षण ये कहता है कि पूरा का पूरा जो देश है वो वी शेप्ड रिकवरी की तरफ बढ़ रहा है। वी शेप्ड रिकवरी मतलब कोरोना पैंडेमिक की वजह से जो गिरावट आई थी, वो गिरावट अब तेज रिकवरी की तरफ वापस उठने को तैयार है। तो ये और हर सेक्टर में ऐसा देखा जा रहा है कि वी शेप रिकवरी है। ये 2 साल में भारत फिर से दुनिया की सबसे तेज रफ्तार अर्थव्यवस्था बन जाएगा, ये बता रहा है। और अगर आप मुख्य बातों की तरफ ध्यान दें तो यही बात समझ में आती है कि जो देश की अर्थव्यवस्था है वो अगले 2 सालों में दुनिया की सबसे तेज रफ्तार अर्थव्यवस्था फिर से हो जाएगी। तो 11% का जो आकलन है वो अगले साल के लिए है, और इस साल के लिए जो गिरावट है, पहले कहा जा रहा था कि 9-10%, लेकिन अब वो 7.7% है। जो डिजिटल तकनीक है वो एक बेहतरीन हथियार के रूप में सामने आई, जिसने कि पूरे देश को बचा के रखा इस पूरी महामारी के दौरान, और उसका जिक्र इस सर्वेक्षण में किया गया है। और कोरोना के दौरान दुनिया की 90% अर्थव्यवस्थाओं में गिरावट दर्ज की गई थी। भारत कोविड-19 के असर को फैलने और इससे हुई मौतों की संख्या को काबू रखने में कामयाब रहा। और जो नंबर्स हैं जो सीए ने हमारे सामने रखे, 37 लाख मामले हो सकते थे कोरोना के, जिसको पैंडेमिक के दौरान लॉकडाउन की वजह से रोका गया। 1 लाख से ज़्यादा मौतों को रोका गया। तो ये कितनी बड़ी कामयाबी है, आप देख सकते हैं। सर्वेक्षण स्पष्ट तौर पर ये कहता है भारत ने कोरोना का जो दूसरा चरण था उसको भी फैलने में एक दक्षता का काम किया, और इसको फैलने नहीं दिया। बाकी अभी आप देखें तो यूएस में वो 2.5 गुना, जो सेकेंड वेव है उसका असर 2.5 गुना दिखाई दिया, और अभी भी लाखों की संख्या में वहां पर मामले आ रहे हैं, लेकिन भारत में ऐसा नहीं हुआ। तो एक तरह से ये बहुत ही जबरदस्त तस्वीर, एक सुनहरी तस्वीर रिकवरी की दिखाता हुआ, और ये कहता हुआ कि अगले साल जो 11% की ग्रोथ रेट है वो काफ़ी इंपॉर्टेंट होने जा रही है। और एक तरह से तंज भी कसते हुए क्रेडिट रेटिंग एजेंसी की ओर सकल की जो फंडामेंटल्स हैं उनको रिफ्लेक्ट नहीं कर रहे हैं दुनिया की 5वीं सबसे बड़ी अर्थव्यवस्था, लेकिन क्रेडिट रेटिंग एजेंसीज उस रियलिटी को वाकई दुनिया के सामने आ नहीं पा रहे हैं, जबकि सारे के फंडामेंटल्स पॉजिटिव नजर आ रहे हैं।
क्रेडिट रेटिंग को लेकर वो थोड़ा सा वहां पे क्रिटिकल रहे, लेकिन साथ ही साथ उन्होंने एक्सप्लेन भी किया कि वहां के अगर क्रेडिट रेटिंग की खास तौर पे बात की जाए तो किस तरीके के चैलेंजेस इस साल, पिछले साल मतलब आए थे। आयुष्मान भारत एंड इट्स इम्पैक्ट, ही टॉक्ड अबाउट दैट एज वेल एज माय कॉलीग Ajay explained what is V-shape economic recovery amidst pandemic time. That was something which is actually very appreciable outcomes, mature policy making amidst pandemic time. He also basically touched upon the ability of the government during the pandemic times in terms of taking bold decisions, and especially coming at a time when the whole world was grappling to deal with the pandemic economically and financially. We at India had an ecosystem and a policy planning apparatus in place. We became the top of the table leaders when it comes to innovation and startup ecosystem.
Absolutely.
In fact, let's talk about the economic survey in a little detail, what it really means. So economic survey 2021 is an ardent tribute to the immortal human spirit of grit and compassion that puts together the tireless battle against the pandemic, as described by CEA himself, especially the frontline COVID-19 warriors he talked about, he addressed, as we speak is already, addressing that press conference. And earlier he also said that the government, in fact, has been very focused on saving lives as well as livelihoods.
This year's economic survey is dedicated to all the COVID warriors who have really helped in upholding India. If you see the cover of the economic survey, we have the COVID warriors joining hands to uphold India. Doctors, nurses, scientists who have helped in developing the vaccine in record time, sanitation workers, one and all who have come together in this time of adversity to really uphold India.
Also, the CEA talked about India's policy response to COVID-19. It was guided by the realization that GDP growth will actually bounce back, but not loss of human lives.
India recognized that GDP growth will come back, and it certainly has, but human lives will not. One of the key things that was pointed out was the need for the pandemic curve to be flattened, because that gives time for the health and the testing infrastructure to be ramped up. A 1 unit increase in the population density has far greater impact on the spread of the pandemic at the onset of that pandemic compared to later. And this is one of the key reasons, one of the key points of research that guided India's
Please do
policy
your homework
response.
first. Well, he asserted that even without lockdown, COVID-19 pandemic would have created significant economic impact. Ajay?
बिल्कुल सही कहा। और उन्होंने ये भी कहा कि जो पैंडेमिक के दौरान जो भी कदम उठाएगा, और मैं अगर स्पेसिफाई करना चाहूँ तो 15 क्षेत्रों में जो बड़े सुधार किए गए, उसमें एग्रीकल्चर, लेबर और दूसरे अलग अलग सेक्टर्स हैं, उनका भी उन्होंने जिक्र किया। और आपने आयुष्मान योजना का जिक्र किया था सकल। बहुत ही अच्छी बात यह है कि एक आकलन हमारे सामने आया कि जिन राज्यों में पीएम जय या फिर जिसे आयुष्मान भारत कहते हैं, अगर उसको अपनाया गया है, वहाँ पर बेहतर नतीजे आए हैं, वहाँ पर मोर्टेलिटी रेट में कमी आई है। और इस लॉकडाउन के दौरान भी इस पीएम योजना ने काफ़ी योगदान दिया। लेकिन एक जैसे कि होता है कि हर सर्वेक्षण में एक कुछ खास बात होती है, तो इसमें जो खास बात मुझे नज़र आ रही है वो एक तरह का इंडेक्स देश के सामने रखा गया है। और इंडेक्स इस बात का कि हमने बेसिक अमेनिटीज, जिसको वो बेसिक
इंडेक्स की अगर बात
नहीं, उन्होंने एक इंडेक्स रखा है देश के सामने, जो कि बेसिक अमेनिटीज जो मूलभूत सेवाएं, जिसको रोटी कपड़ा मकान के जरिए समझा रहे थे, उसमें कितना बेहतर हुआ है। तो 2012 से 2018 के बीच में जो आपने मैप देखा, तो गाँव में काफ़ी बेहतर हुई है तस्वीर। और अगर हम मुख्य बातों पर ध्यान दें और आर्थिक सर्वेक्षण के, तो वो 2021-22 की, जिसके हम लगातार आपको बता रहे हैं कि अगले 2 सालों में जो अर्थव्यवस्था है वो पॉजिटिव, एक तरह से सबसे बेहतरीन नज़र आ सकती है। अगले 2 सालों में भारत फिर से दुनिया का तेज़ रफ्तार अर्थव्यवस्था हो सकता है। और ये जो संरचनात्मक सुधार जो उसकी हम बात कर रहे थे, मैं चाहूँगा अगर आप इसको प्लीज़ फुल फ्रेम ले पाएँ तो हमारे दर्शक ये समझ पाएंगे कि जो रिफॉर्म्स हैं वो किस दिशा में आगे बढ़ रहे हैं। लेकिन मुझे लगता है कि अब इस चर्चा को यहीं पर थामना पड़ेगा, इस सफ़र को, और हमें चलना पड़ेगा अगले
आइकॉनिक विजय चौक, जहां पे थोड़ी देर में बीटिंग द रिट्रीट सेरेमनी का प्रारंभ होने वाला है। बीटिंग रिट्रीट सेरेमनी, रिमेंबर, इट्स हेल्ड एवरी ईयर ऑन January 29th, marking the culmination of the 4-day long celebration of Republic Day. It's a special broadcast.
नमस्कार। नई दिल्ली के ऐतिहासिक विजय चौक से इस विशेष प्रसारण में आप सभी का हार्दिक स्वागत है।